Singh, your bariatric nutritionist, presently working with Forest Hospital. Today, I would like to discuss about the most important questions that have been asked by almost all the patients about how and what we can have in our daily routines. How our life is going to be a little different post the surgery. So today, I'm going to point out some little things that you really need to be careful about post your surgery. First and foremost, the most important thing is that we need to get used to small frequent meals and small sips of water. As explained earlier, that now our stomach size is little less as compared to what it was earlier. So we can take a little quantity of meal at one particular time, though the frequency increases. For example, we have this glass which has roughly 250 ml of liquids, your favorite lemon water in it. Earlier, post-surgery, you could have this lemon water in a gulp. You could finish it off. But now, if we have this glass, this is 150 ml, which you're supposed to take in roughly 10 minutes maybe, just keep on sipping it slowly and steadily and you're okay with it. The most important thing is small sips. That is it. Nothing else changes, but just how you are taking the food just changes that. Apart from that, the next important point would be that you need to keep yourself hydrated. You need to keep yourself very well hydrated the entire day. We expect somewhere around close to 2 to 2.5 liters of liquids, which will include your water also and other low-cal beverages like lemon water, coconut water and your buttermilk or your charge, so that it keeps your system going. We do not want any dehydration episodes, so we request patients to have enough of liquids the entire day. Now, one important thing, that how would a meal look post my surgery? In the beginning, yes, we've understood that we need to start only with our liquids, and then apart from that, we need to start with our puree, which would again have one particular little meal. But in the long run, like post 1 year of the surgery or post 1 month of the surgery, what am I going to eat? How is my plate going to look like? So here is something that I would like to show you. Now, before the surgery, you have a meal considering everything, which has all your things, your pulses, your cereals, your vegetables, your yogurt, your salad and your sweet also. But post the surgery, you need to have almost everything. You can eat almost all the things, but the quantity goes down. Now here, before surgery, if we are having a big bowl of vegetable, but now it is going to be a small bowl of vegetable. The curd is going to be in a small portion, so that you get everything in your meal but in a smaller portion, and you get used to eating very slowly and chewing your food properly and take your well time. Next most important thing would be that in our plate, we need to make sure that we have enough of proteins. And proteins is the most important thing to finish first. Proteins always come first, like your yogurt, your pulses or your dal, or any of the paneer vegetable, for example, or your chicken or your fish, whatever you eat. We would be discussing more about proteins a little later. Now, apart from these two most important points, the next point comes down is there are 3 S which are a strict no. Now, what are the 3 S? Rather, not just 3, we take them as 5. The 5 S that we tell them which are strictly prohibited are: number 1, your sodas. Number 1, any sodas, any aerated drinks is your first S that is strictly prohibited, because the sodas tend to, if we drink a lot of sodas, we tend to expand the size of your pouch, which we do not want to in the longer run. The next important thing is a straw. Many patients ask me, why a straw? I mean, how can a straw, tiny straw, harm me? But yes, it can harm you. It can harm because we would not realize that how much quantity of liquids are we taking in at a particular time. It would be more than what it is needed or recommended. And secondly, we inculcate a lot of air while taking our meals with the straw. So to avoid that, we need to quit the straw at all. And apart from that, the next S would be the sugar. Sugar, for obvious reasons, that we expect you to be on a calories restrictive diet. So sugar is a strict no-no from our end, because it is empty calories, and specifically for patients who have been suffering from diabetes, they need to understand that they are not on any oral hypoglycemics or insulins post the surgery, so they need to make sure that sugar is not a part of their meal. The next point would be that we need to have very often liquids in our meal, as we've discussed earlier. There's another point that I would like to bring up to your notice is that we need to increase the physical activity also on a day-to-day basis, and we need to have a good walk routine, good schedule. We would be discussing a little more details about the physical activity in a separate segment out here for sure. But yes, physical activity would be a very vital role, would play a very vital role in the success of the surgery. Now to sum up with the thing, the 5S that we've strictly avoided, which would be your sugar, straw, sodas, spirits, alcohols and smoking. And then your portion size that changes, it's going to be small frequent meals that we need to learn, and sipping liquids the entire day. If we get through all these things, we are going to be successful in every surgery. Thank you so much.